Hi, Neva Herzig from Core Dynamics Physical Therapy in Englewood, New Jersey. You've recently been diagnosed with a pelvic organ prolapse. What does that actually mean? A prolapse occurs when an organ has fallen down from its original position. This could occur from weakness in the tissues, the muscles, the ligaments, the fascia, possibly after several pregnancies, maybe severe constipation, and what I find is just improper use of the body. The exercises I'll discuss today are just general exercises you can begin until you get to see a physical therapist that specializes in pelvic floor dysfunction. These are not made for everybody, and please be aware that you may want to have some sort of medical assessment before starting any exercise or any program. Let's get started. The first exercise that many of you guys know of is our pelvic floor exercise, or known as Kegels to many of you. In this video, we're going to skip that part because many of you are doing that, and because I believe in a full pelvic floor assessment prior to somebody starting their pelvic floor exercises. So we're going to start off with breathing, which is something we all do. There are definitely variations of breathing, but I'm going to use this type of breathing so you can know when to engage muscles when you have a little bit more exertion. So you can place your hand on your chest and one on your belly and start with just taking a few deep breaths. Inhale and exhale. As you inhale, you'll see your hands moving away from your body, and as you exhale, they bring in back. So go ahead again, take a nice deep breath, and now exhale forcefully. As you increase that blowing out, you'll feel your belly muscles pull in a little bit tighter. Think about that when you need a little bit more assistance in some of the other exercises that you'll be doing. The first exercise we're going to start with is called a bridge. You can start by laying on your back with your knees bent, feet on the floor. I've chosen not to have shoes on today, but you can definitely have shoes on. I would not do this just with socks, so either shoes and socks or just no shoes, no socks. So place your hands by your body, close by, and you're going to press down into the earth. Using your feet, pressing down onto your mat, you're going to start by lifting up your buttocks into the air. And then slowly back down where the buttocks are the last ones to go down. Again, come on up and back down. And then again up and back down. If you notice that you're struggling lifting your bottom up into the air, into this inclined position, use that exhale as you push up. So again, remember, our belly muscles pulled in as we exhaled a little bit more forcefully, that we were able to engage our belly muscles to help us do this exercise. Again, come on up and back down. Make sure you're breathing as you come up and back down. Continue this for anywhere from 10 to 15 repetitions. Next exercise we're going to perform is called a clam. Place your head down, you can rest it on your arm, and one leg over the other one, bent knees about 90 degrees, and the feet right behind you. You're going to start with the top leg moving upwards towards the ceiling. This does not have to be a large movement, but just control it. You're going to feel this on the side of your hip. If you are rolling back and forth, you are performing this exercise incorrectly. So up and down, slowly and controlled. You can have your belly muscles gently engaged. And keep doing this for about 10 or 15 repetitions as well. And then flip over and do the other side. The last exercise we're going to do is going to be on our hands and knees, and you're going to use a small air-filled ball. This ball could be a little bit bigger than this one, or you can roll up a towel or a small pillow. So come onto your hands and knees, take the ball, and place it right in between your knees. Press the ground firmly, and then go ahead and just move your legs towards the ball or your towel or pillow roll and squeeze. You should feel your inner thighs engage and your belly muscles naturally pull in. Hold that for 10 seconds and then release. Again, squeeze the ball and hold. 10 seconds and release. You want to keep your back straight, your head looking down with a little bit forward, just not bent, as you continue on squeezing the ball for 10 seconds and then let go. For this exercise, you'll be doing 10 repetitions. Good. And I'll do one more. You continue on for your 10 repetitions.